Safety and health at work. This is your right and theirs too. Because everyone should return home safely to their loved ones after work every day. But some are not so lucky. They don't make it home safely. Workplace accidents claim lives. No one should die at work. Most workplace accidents can be prevented if all of us play our role to develop a culture for safety and health. A strong culture where all stakeholders take responsibility for their work is what the new Occupational Safety and Health Framework wants to achieve. Introduced in March 2005, the new framework aims to propel Singapore to be one of the top 10 safest countries in the world. By 2015, we hope to halve our workplace fatality and injury rates. The new Workplace Safety and Health Framework highlights 3 principles. First, companies must have greater ownership of safety outcomes. After all, companies know their work best and what safety practices to develop. This includes teaching workers how to use personal protective equipment correctly. Second, companies need to reduce risks at source. All parties must take responsibility to reduce risks in their areas of work. One such area is working at height. Measures must be in place to protect workers from falling. Those who fail to do so will be held accountable. Third, under the new framework, companies with poor safety management will be imposed heavier penalties. Companies are expected to create safe systems and processes company-wide. The penalty is imposed on those who do not put in efforts, whether or not an accident has occurred. Since the new framework was introduced, we have achieved several important milestones. In September 2005, the Workplace Safety and Health Advisory Committee was formed. In March 2006, a new Workplace Safety and Health Act took effect. A new Program-Based Engagement, or PROBE, was introduced to combine enforcement with engagement efforts. In September 2006, a new Workplace Safety and Health Risk Management Regulations took effect. The Workplace Safety and Health Act took effect on 1st March 2006. It replaces the former Factories Act. It covers the traditional factories such as construction sites, shipyards, manufacturing plants and warehouses. The Ministry of Manpower announced the expansion of the Act to cover new sectors like hotels, restaurants, hospitals and landscaping works from March 2008. The Workplace Safety and Health Act embodies the key principles of the new framework. First, it talks about a new liability regime where responsibility extends to all. Previously, responsibility fell on the factory occupier. Now, everybody on the value chain can be held accountable. This includes employers, professionals, supervisors, workers, people who install, maintain or modify equipment, and even manufacturers and suppliers. Second, the Act adopts an outcome-based or performance-based approach. Previously, stakeholders need only to comply with what is stated in the Factories Act in terms of managing safety. Now, the onus is on individuals to take reasonably practical measures to ensure that work is done safely. Stakeholders should decide on how work can be done in a safe and healthy manner. Third, the Act imposes higher penalties for poor safety performance. Previously, the law was not able to mete out meaningful penalties where the party should be held responsible. The new Act allows the courts to take into account all relevant circumstances of the case, such as the culpability of the stakeholders and the potential harm. To penalize companies which have failed to protect their workers, the Act also more than doubled the maximum penalty for first offenders from $200,000 to $500,000. The new incident reporting regulations encourages employers and occupiers to take responsibility in monitoring and preventing workplace incidents. It states that all employers, occupiers and medical practitioners have the duty to report and keep records of accidents, dangerous occurrences and occupational diseases. This applies for companies with employees involved in workplace incidents, such as incidents that involve the death of an employee, incidents that involve the injury of an employee who is given more than 3 consecutive days of medical leave, incidents that involve the injury of an employee who was hospitalized for at least 24 hours, occurrence of an occupational disease, incidents that involve a self-employed person or a person not at work must also be reported. The concept of a person not at work includes anyone who is not an employee. For example, if a visitor slips at the workplace and it's taken to hospital for treatment, the incident must be reported. Reporting is easy. Submit through an online single-point reporting system, iReport, for both workplace incidents and work injury compensation cases. iReport is accessible from the Ministry of Manpower website at www.mom.gov.sg/iReport. The Ministry would like to encourage parties to report incidents. Reporting is not an admission of liability. There are penalties for failing to report incidents. Those who fail to make a report may be fined up to $5,000 for first-time offenders and up to $10,000 or up to 6 months of jail term for repeat offenders. To find out more about workplace safety and health legislation, go to the Workplace Safety and Health Advisory Committee website at www.wsh.sg.